Chatterbox Speech Therapy is a new up-and-coming speech and language therapy clinic here in the Duke City, which aims to be a community resource where clients and their families can access therapy services and related programs, along with the materials that are essential for growth and progress. Joining us now are the founders, Lisa McDermott, along with Tanya Salazar. Ladies, thank you for joining us this morning. So, first of all, let's talk about this. This is May, and I just learned this. May is Better Hearing and Speech Month. What is that all about?
Yes, every year during the month of May, the American Speech and Hearing Association promotes and celebrates a campaign called Better Hearing and Speech Month. And the goal is to raise awareness for communication disorders and talk about the importance of early intervention.
Gotcha. Okay. Now, I have a 2.5-year-old, and so, things like this are always concerns. I want to make sure that she is the best health possible. What are some of the signs that mommies and daddies can be looking for if we might think that our child has a communication disability or a communication issue? Aside from the fact that they just don't want to listen.
Right. Well, some of the early signs for little ones, if they're not smiling and interacting with others, and they're not starting to babble and make some sounds between 4 and 7 months, that's an early sign.
4 and 7 months, okay.
And then as they get older, if they're not combining words by 2 years old, that's a concern. And then even into older years, if they're starting to have trouble in school with early reading and writing skills, those are all early indicators of some communication difficulties.
And so, Lisa, how can Chatterbox help with this situation? We find out that our kid might have an issue. What's the steps to come in and help them?
Typically what happens is we get a phone call for a screening. We offer free screenings in our clinic, so if you have a concern and you're not quite sure where a kiddo falls out, give us a call. We'll schedule you a screening. You come in, we do a quick about 10-minute screener, which consists of a little bit of an interview and some testing. And then from there we recommend, if it looks like there is a true legitimate concern, we recommend an evaluation right then and there. Okay. Or we can schedule it out. Kids will come back for an evaluation. We look at speech, language, whatever the issues are that we've kind of parceled out from the screening. And from there, we recommend the kind of therapy that would be most appropriate.
Sure. So, and it varies. Now, what is the earliest age that you take? Do you take down to 4 months old if we're concerned that we have an issue?
We do.
Yeah.
We
do?
We do.
We don't have a lot right now, but both Tanya and I have worked early infant learning kinds of programs, and so we know how to work with those little babies.
That's great.
And so yes, absolutely.
The earlier the better.
The earlier the better, absolutely. So this month, of course, it being the Speech and Hearing, Better Speech and Hearing Month, do you guys have any special events going on at the facilities?
Not so much events, but we are doing a lot to promote it, to promote that awareness and what it is to look for in the early signs. So on our Facebook, we're doing a lot of weekly updates of things, resources for parents, and also posting some activities that parents can start doing with their children at home that really enhances the speech and language skills. So
that's great. Well, ladies, thank you so much. Thanks for offering this service.
Thank you.
And for more information, head over to KASA.com, click on the Style tab. We're going to